Healthcare reform heats up in D.C. and right here at home.
Absolutely. News 10's Jessica Hayes is back from Washington, D.C., where she interviewed our lawmakers about healthcare coverage. She joins us now live in the studio for the first of her three-part series, It's Not Your Decision. Jessica?
Patrice, we covered everything from taxpayer-funded abortions to Medicare cuts in our healthcare discussions with Illinois and Indiana lawmakers. And they didn't see eye to eye on most matters. One topic of particular disagreement was the public option, government-run healthcare. The main fear being rationed care for Americans. In the first of our three-part series, we'll look at what our lawmakers had to say and let you decide for yourself.
When everybody's in the public option, then government's going to control care. How are they going to do that? They're going to control costs by rationing care.
Illinois Representative John Shimkus says a government-run public option in the health care bill will lead to folks' worst fears of rationed care. Other lawmakers say it'll be just one option once coverage is mandatory.
I support the public option, and it's just that, it's an option. If people don't want to buy the not-for-profit health insurance plan, they don't have to.
But Indiana Senator Richard Lugar says eventually the public option won't offer folks any other choice.
I'm not in favor of the public option because I believe that despite all the protests, it inevitably is the first part of a series of actions that will lead to it being the only option.
Shimkus agrees, saying cost cuts to private insurers will drive them out of business, leaving folks with no choice but to turn to the government.
Then you have one insurer. And who is it? It's the federal government. And so then we tie in this what's called comparative effectiveness, which is going to help educate people on the best quality care for the lowest cost. This is what happened in the British health system, and that's the system that now rations care.
He says health care is a responsibility the government is not equipped to handle.
We don't have enough docs, we don't have enough general practitioners, and so that's the other thing. Our nurses, CNAs, you name it, we don't have them.
The bill that eventually heads to the president will likely include a public option, something Indiana Representative Brad Ellsworth is in favor of.
He says once the government is the only option, it will inevitably have to ration care.
Well, you know, that's with all due respect to Mr. Shimkus, those are the same arguments they said about Medicare, Medicaid, that it was just the gateway to single payer. It's just not true.
Our lawmakers did agree something needs to be done about health care, but what to do and how to do it are still up for debate. Now, before we left for D.C., we recorded questions from many of you. To see your lawmakers' answers, head to our website and click on the tab titled It's Not Your Decision. And join us for the second of our three-part series tomorrow on News 10 at 6 when we look at the possibility of criminal charges if you refuse to buy mandated coverage. Patrice.